Hi there, it's Stephen D. Been away for a while, but I'm back because what the hell? I read something on New England Journal of Medicine, you know, but let me digress for a minute. You know all that stuff about single payer that was going to be, passed in New York and California, and then I don't know, didn't get passed by the democratically controlled legislatures of those two states. That sucks, doesn't it? I mean, but then again, it's so damn expensive. It's so impossible to deal with. Oh, wait a minute. That's not right. That's a lie. It's not. And I got some proof right here. It's from the an article in the New England Journal of Medicine, published June 21st, 2017. It's called Health Insurance Coverage in Health: What the Recent Evidence Tells Us. I'm not going to read the whole damn article to you. I'll link it, down there, where it says read more on the YouTube thing. But I'm going to read a little bit about it. You remember the Affordable Care Act had something called Medicaid expansion. That's right, Medicaid expansion. It expanded Medicaid, except for those states where asshole Republican governors said, no, we're not going to expand Medicaid. Nah, fuck that. But where it did expand Medicaid, well, guess what this study in the, again, New England Journal of Medicine, probably the most prestigious medical journal in the United States, possibly in the world. I'm going to read you a little bit about what they said about expanding Medicaid. This is what it says, okay? I'm reading it word for word. So this isn't my damn opinion. This is the damn opinion of, people with M.D.s and Ph.Ds and all that kind of crap. Here's what it says. An analysis of mortality changes after Medicaid expansion. Oh, maybe I should do my Chuck Schumer thing and like that. Yeah. Okay. Yeah. How does that look? Does it work for me as well as it work for you, Chucky? Let me know. An analysis of mortality changes after Medicaid expansion suggests that expanding Medicaid saves lives at a societal cost of $327,000 to $867,000 per life saved. Prices vary by state. That's horrible, isn't it? Actually not. No, that's actually pretty good. By comparison, other public policies that reduce mortality have been found to average $7.6 million per life saved. Whoa! Did I read that right? I'm looking at it really carefully now. Yeah, I read that right. Other stuff we do to save lives costs $7.6 million. That's the best. Other than, something like Medicaid expansion, which might cost us $350,000 to $850,000, depending on the state, of course, you live in. And so here's what they go on to say. And I'm going to paraphrase. This suggests that expanding health insurance is a more cost-effective investment than many others we currently make in areas such as workplace safety and environmental protections. Jesus fucking Christ. Oh my God, I didn't say it. Jesus doesn't fuck Christ. Didn't mean to say that. Jesus frickin' Christ. That's amazing. And that's just That's what single payer would do, isn't it? It would expand coverage. It'd be great, wouldn't it? And it would be the cheapest way we could to save lives. Cheapest way. That sounds like a pretty damn good thing to get behind. So why? I mean, I understand why the Republicans aren't behind it. Because they don't give a damn if you die. They soon. No, they don't. They don't give a shit if you die. They give a shit if one of their people die. When somebody in their family dies. Then all of a sudden we got to, fund some, special bill that supports some rare cancer or something. But no, they don't give a shit about you. But, the Democratic Party, they say they care about us. So why aren't they, and they had a chance. They had a chance in 2 states, 2 biggest states in the country. 2 states that lead the nation. That would, if we'd passed single payer in those states, it would have been amazing. It possibly would have triggered, similar single payer initiatives in other states. So why didn't the Democrats get behind this? Well, I'm going to read a little bit more about what they said in this study, which I think maybe sheds a little light on why the Democratic Party, and of course the Republican Party too, but we already know they don't give a shit about you, but why the Democratic Party, as it's currently constituted, taking donations from large corporations in the healthcare industry and in the healthcare insurance industry and in the pharmaceutical industry. This is why why the Democratic Party, as is presently constituted, decided not to pass single payer health care in New York and California. Okay? Just possibly take this with an open mind. Factoring in enhanced well-being, mental health, and other outcomes would only further improve the cost-benefit ratio. So universal health care coverage, great, right? I mean, especially, universal health care coverage like single payer, which that's what Medicaid is. Medicaid is a single payer insurance program. However, this is what the authors go on to say. But ultimately, policymakers and other stakeholders mean the people that donate to the Republican and Democratic parties. You thought stakeholders meant you or me, right? No. If you've ever been able to get one of your Congress critters to do something for you without contributing massive amounts of money to them, I want to meet you and shake your hand, because that's just not the way it works. But ultimately, policymakers and other stakeholders must decide how much they value these improvements in health relative to other uses of public resources. Yeah. And here they give you a couple examples of what other uses of public resources might be. From spending them on on education and other social services. Well, we know the Republicans aren't going to do that, and frankly, I haven't seen the Democrats do that a whole lot either. To reducing taxes. Reducing taxes. Well, we all know what the policymakers and stakeholders are going to jump at. Are they going to jump at finding the most cost-effective way to save your life? Or are they going to do stuff that improves their bottom line and provides more money to parasites like the politicians who take their money? I think the stakeholders are going to say, Die, motherfucker. Just fucking die. After we take all your money. But there it is. It's in black and white. It's in the New England Journal of Medicine. Expanding, single payer like Medicaid improves, not improves, saves lives. And it's the most cost effective. All you people worried about, oh, it's going to cost so much money. It's the most cost effective way to promote and, people's lives, save people's lives, make people's lives better. It's the cheapest thing we could do. Unless our real interest is promoting the profits of the companies that are, taking our money hand over fist to make profits and pay themselves big salaries. So we will, die sooner and poorer. Just something to think about, just saying. I don't think our politicians in the Democratic Party give a shit about us, most of them. I'll be up front. But maybe you could send this, go down and click on that link down there. And maybe you could send this to them and say, hey, and then get this particular, little piece of information I wrote out. It's only one paragraph. It's pretty short. And it says that expanding Medicaid saves lives, and it's the most cost-effective way to do it. More cost-effective than anything else we do to save lives in America. And then say, and Medicaid is a single-payer health insurance program. And it's not even run very well. Because we shortchange it. We don't even... we don't do it well. Medicaid insurance is great, but because all over the country doctors can opt out of not having to, accept it. But, if we had Medicare for all, they accept Medicare. Yeah, they do. Because they have to. Think about that, all right? Just give that some thought. And then send this little article, and certainly this little, paragraph I said is toward the end, but you'll find it. Begins an analysis of mortality changes after Medicaid expansion. And send that to them. And say, give us our goddamn single-payer health care. Sorry, I didn't want to hit this. Hit. My hand might hurt. And I might have a hemorrhage, and that might mean I die because maybe I didn't have the money to pay for going to the emergency room, and I would decide not to go, and then I'd get a blood clot. And, well, anyway, you get the idea. Anyway, that's Stephen D. Try not to be really, really fucking angry about the fact that the Democrats killed single payer in New York and California, and they're letting the Republicans get away with destroying what few benefits we got out of the ACA so we can give tax, cuts to the wealthiest people in the country. Take care, everybody. See you when I see you. Bye.